Hepatitis B e-antigen. What is hepatitis B e-antigen? HBeAg is actually the abbreviation word of hepatitis B envelope antigen. This is the e-antigen of the virus. Through that can determine how the hepatitis B virus works and how it is able to spread disease among people. Hepatitis B e-antigen is a protein from the hepatitis B virus that circulates in infected blood when the virus is actively reproducing. HBeAg positive means? If you are HBeAg positive, it means the antigen is present in your blood. This HBeAg test result suggests that a person is infectious and is able to spread the virus to other people. If the HBeAg antigen tends to change from positive to negative and the appearance of anti-HBe, also known as HBeAb, then the body's serum has shown signs of transformation. Is HBeAg test mandatory? The HBeAg test is actually for HBV viral infection in the liver. That helps to determine the degree of hepatitis B infection in the patient accurately. Therefore, they play a very important role in the diagnosis of liver disease. What happened if HBeAg test is positive? A positive test for the hepatitis B e-antigen, HBeAg, means there is an active infection with the hepatitis B virus with chronic hepatitis B. The virus is actively multiplying rapidly. If anyone contact with your blood or body fluids is a higher risk of transmitting of HBV infection to others easily. What happened if HBeAg test is negative? If the HBeAg test result is negative, it means that the e-antigen is no longer present in the body someone diagnosed with hepatitis B, but it can be possible. The virus can replicate an HBeAg negative person to require treatment and require careful monitoring. A negative HBeAg result may indicate early acute infection before the peak of viral replication or early recovery when HBeAg has declined below detectable levels. There are 2 points we can say about HBeAg. 1. In case of negative HBeAg means the hepatitis B virus is in active mode at the moment in the body. 2. In case of positive HBeAg, the virus is active but showing signs of a genetic mutation encoding, and to get the correct conclusion, the patient needs to do some other viral tests such as HBV genotyping and HBV DNA. Positive HBeAg index followed by an elevated liver enzymes index and the liver begins to show signs and symptoms of inflammation. The patient is confirmed to have had hepatitis B virus and this condition becomes worse because the virus is active and has a high risk of infection. Further, HBeAg positive is divided into 2 specific cases. Liver functions are normal despite a positive HBeAg test result. If this is the case, then the ability to stop viruses from working and put them back to sleep becomes simpler and more effective. In the case of positive HBeAg, liver function is affected. Quick treatment is required based on the test results. The doctor will tend to treat with the appropriate antibiotic. Case study 1. If a woman is pregnant in the last trimester of pregnancy and HBeAg test is positive, the chance of her fetus being infected with hepatitis B is very high. Therefore, pregnant women need to have periodic health examinations to be able to prevent hepatitis B and take timely intervention if unfortunately get sick. Case study 2. A negative HBeAg indicates that the hepatitis B virus is in a restful state. This virus is temporarily inactive and does not affect liver function, so the patient does not have to take medicines to treat hepatitis B, but still you need to get regular checkups every 3 months to be proactive in preventing hepatitis B with appropriate treatment. Case study 3. If the patient age above 40 years with hepatitis B and HBeAg positive, it is even more important to pay attention to regular health examinations. Case study 4. A liver biopsy test is needed in every 10 years to know the actual liver condition in case of chronic hepatitis B patient with HBeAg positive. That can accurately measure the liver signs of necrosis or not. Case study 5. In the case of liver necrosis or cirrhosis, it is necessary to handle and treat in a quick way. Because at this time the patient's health condition is showing signs of serious change and can be dangerous to life. Case study 6. HBeAg is negative but the load of HBV DNA is within 10 to the power of 4 copies per milliliter or more and the amount of HBsAg is positive. The patient must continue treatment according to the treatment schedule given by the doctor. HBeAg in case of chronic hepatitis B. People with chronic hepatitis B can show seroconversion. This means the levels of HBeAg drop until they're no longer detected while levels of anti-HBe antibodies develop. This is seen as a good sign for prognosis and an indication that your treatment may be working successfully. What should be considered before going to HBeAg test? Before testing for HBeAg, patients need to pay attention to the following factors. Because these factors directly affect the patient's test results, absolutely do not use drugs such or alcohol when preparing for the test. Before taking the HBeAg test, you should not take any medicine for 1 week. When having HBeAg test results, you need to pay attention to maintain a scientific diet and rest. Diet high in green vegetables. Avoid drinking alcohol. Do regular health checkups and follow the instructions and treatment as prescribed by your doctor. When should I get tested for HBeAg test? If HBeAg is negative, there is little chance of transmission. Conversely, if HBeAg is positive, the possibility of infection is very high. In the case of a positive HBeAg test, doctors may order some additional tests for ALT-ast liver enzymes to suggest appropriate treatment. A high or low HBeAg index corresponds to the concentration of the virus in the body. If the HBeAg index decreases gradually after treatment, it shows that the treatment is effective. Clinical reference range of values. HBeAg reference values. Non-reactive. A non-reactive result may indicate early acute infection before the peak of viral replication or resolution of infection or suppression of viral replication. Non-reactive. HBeAg reference values as non-reactive means the person is free from hepatitis B virus. Reactive. A reactive HBeAg indicates rapid viral replication usually associated with high HBV DNA levels. HBeAg reactive patients are considered highly infectious. If you like this video, then please share your comment in the comment box. Please subscribe and share our videos. Stay happy, stay healthy. Thanks for watching Great Wisdom of Health channel.